Starting later this morning, a federal medical team will be joining the staff at Sparrow Hospital in Lansing to help treat COVID-19 patients.
This comes after the federal government approved a request from Governor Whitmer for additional staffing in Michigan hospitals. Joining us now live from Sparrow Hospital in Lansing is 6 News reporter Michael Thomas.
He's here for you now with more on this national visit coming up. Good morning, Michael.
Yeah, good morning, everyone. You know, this team really arrived over the weekend, and there's about 20+ people, and that includes doctors, nurses, some respiratory therapists, and they're really coming in to basically revive those nurses and doctors who have been working tirelessly for the last 2 years. Now, joining me is the president of Sparrow. His name is Alan Vierling. Tell me a little bit about this. Now, we talked about earlier, you know, there's a shortage of basically nurses in a sense because they're all kind of worn out. So what is this really going to do for this community and for Sparrow workers specifically?
Yeah, so it's really important for us. We'll get about 14 nurses out of this and 4 physicians and a couple of respiratory therapists. And so, you know, like a lot of hospitals, we lost a lot of staff over the last couple of years. And so for us, this means supplementing our workforce, you know, but bringing in a new sense of energy into what we do. You can get very tired doing this, and you suffer some moral distress. And so to see the Army come in, these very bright, very articulate, very polite, smart young people coming in here, it's just been a real burst of good positive energy, and that's going to matter a lot. Plus, it relieves some of the load from our staff, which is really critically important.
And they arrived on Saturday, everyone, and he was telling me over the break basically that they arrived really in good spirits. They arrived on time, super early. There was a group out here welcoming them, you know, clapping and everything. And before we let you go, I want you to talk just a little bit about, you know, people are saying, you know, well, COVID numbers are going down, but when it comes to hospitals and stuff, you guys are still really feeling that pain of being overwhelmed, right?
100%. The rest of society has moved on. Hospitals have not. And so, for instance, we will keep patients in our emergency department who need to be admitted for extended periods of time. We're no less busy today than we've ever been. Our COVID numbers may be different, but when people weren't here for COVID, they were at home continuing to have other chronic health issues, strokes, heart attacks, you know, diabetes, these things. And so all these patients are still here. We have COVID on top of it. We are still as busy as we've been.
All right. Well, thank you so much. And later on in the week, we're hoping to get to talk to some of those national caregivers, again, that came in from across the country, and we'll continue to keep you updated both online and, of course, on air. Here for you live this morning in Lansing, Michael Thomas, 6 News.